Hi, I'm Chris Martin, and I'd like to expose a silent but potentially severely debilitating problem of epidemic proportion in America today. This problem has received little or scant attention among the media, the research literature, or medical professionals or societies alike. The silence is deafening. This iatrogenic problem is called empty nose syndrome, or ENS. I have suffered from empty nose syndrome for 11 years now. I was in great health throughout my childhood, playing tennis and participating in athletic activities for hours on end. I had about 2 years of recurrent sore throats and sinus infections starting at age 16. I received antibiotic treatment from my ear, nose, and throat specialist, but the doctor did not recommend preventative treatment for allergies or use of simple remedies such as saline irrigation. These simple remedies could have healed my nose. Instead, the doctor recommended I receive a septoplasty and partial turbinectomy. A septoplasty is where the septum, or midline of the nose, is straightened, while a partial turbinectomy removes the turbinates by about 2/3. Regrettably, I had far more removed than I was told and had paid the price of lifelong regret for the decision to undergo nasal surgery. I learned in just recent years by professional evaluation of my CT scans that I had 90% of my middle turbinates removed, 90% of my right inferior turbinate removed, and 70% of my left inferior turbinates removed. I had a hole high in my septum. My ethmoid cells, which are the sinus cavities between my eyes, were partly removed, and there was a hole in my maxillary sinus. Clearly, far more was resected than stated by the procedures septoplasty and partial turbinectomy, and I have suffered seriously ever since with only partial improvement of my symptoms. Before describing my symptoms, it is important to first understand the roles of the turbinates, which are relatively unknown structures in the nose. The inferior and middle turbinates are similar in size to our fingers. The turbinates are critical organs in the nose that serve many functions, including heating, humidifying, filtering air. They also contain nerve cells and direct airflow in an orderly pattern so that the air can strike all regions of the nose, so messages can be sent from the brain to tell the lungs when to inflate or deflate. It is also a well-known fact that they provide 50% of the airflow resistance to the lungs, as the nose is considered the guardian of the lungs. The turbinates also modulate temperature and pressure of incoming air. They help us enjoy satisfying deep nasal breathing that releases endorphins, and such breathing is more protective for our health than mouth breathing. When they are totally removed or reduced in size, it is logical follows that an important organ will not function, leaving the nose dysfunctional, just like if you removed a finger from your hand. Yet unfortunately, many ear, nose, and throat specialists and plastic surgeons acknowledge the important roles of the turbinates, yet these same professionals do not seem to appreciate that reducing or removing turbinates can cause harm. While I acknowledge a conservative turbinate reduction might bring some relief, the lack of attention to the more serious side effects of overly aggressive turbinate reductions is troubling and seems to be in the interest of protecting a profitable business over a patient's health. During many office visits, most ENTs would downplay my symptoms, for example, just noting a temporary issue such as an irritated throat. It should not be a surprise that many who have ENS don't know it, and doctors are slow to diagnose people as having ENS because not only is it a difficult diagnosis, but also too many professionals appear more concerned with protecting themselves from medical malpractice suits than the health of the patient. While ENS is not necessarily a common problem, given the issues with misdiagnosis and quietness of the medical community to acknowledge or address ENS, it is likely more common than you think. There are roughly 500,000 surgeries in America each year that involve a turbinate reduction, for example. I have met many ENS sufferers locally, for instance, because of the book I wrote, but I would have never known there is such a population otherwise. It has been a long, tiresome journey that requires constant management in my quest for better health. I'd be remiss not to suggest I am blessed because of my wonderful, beautiful wife and family and faith in Christ, but I must acknowledge I have suffered much physically. Some of the symptoms have included being excessively preoccupied with my nose. Breathing in dry, recirculated air in car rides has often been unbearable because of my poor nasal breathing, thick mucus, and difficulty concentrating. In the years following my surgery, I frequently tested myself to see if low blood sugar was the reason for my dizziness. At times I blew my nose with all my might, but nothing would exit. The mucus was so sticky and dry that there were times when I wondered if my nose produced any mucus at all. The dryness was at times parching and unbearable. I've also suffered from a chronically irritated throat, frequently throwing up after meals due to my irritated throat, dryness, and the excessive phlegm that accumulated in the back of my nose and upper throat. Shallow sleep. I often would get few hours of sleep because of my nose, and the sleep that I had was not satisfying nor refreshing. I would be fatigued during the day and almost wake up tired. Chronic sinus infections. The sinus infections did not only go away after my nasal surgery, but they intensified. I often incurred sinus infections that would last 2 to 3 weeks and were more challenging to fight than prior to my surgery because my nasal defense system was now absent since my turbinates were removed. My voice often sounded nasally as well. Air pressure. Often my ears would feel like a balloon that was about to burst. It would hypothetically only deflate if I were to put a needle in them. I have enjoyed partial improvement in my symptoms thanks in large part to Allerderm implants by Dr. Hauser of Cleveland, as well as educating myself about my nose and how to treat it. I have had an Allerderm graft implanted into my right septum and strips into my left inferior turbinate. The implants have helped produce more moisture, heat, and thinner mucus, although I still have chronic postnasal drip, improved sleep, and a more normal voice due to the increased airflow resistance. They have helped partially recover some of my nasal functions, but they are not a cure. Most looking at me would assume I am 100% healthy because my problem is not visible like a broken leg. ENS is a silent epidemic. Only doctors know how to interpret CT scans, and you can't tell I have ENS by just looking at me. Some doctors have caused serious harm with ENS, but very few are looking to help us. ENS sufferers are therefore overly appreciative to go to an ENT who understands the gravity of our symptoms and listens to our concerns, such as Dr. Hauser, Dr. Grossan, Dr. Titchener, and Dr. Kern. So few ENT specialists seem to care or seek to understand. Frankly, it's a formidable thought, but I don't know to whom we ENS sufferers could turn if it were not for a caring, compassionate doctor such as Dr. Hauser. Right now, there is a government-funded study of a procedure that causes ENS, but there is no government study that seeks to find a cure for ENS, which would involve regenerating turbinates. These are just some of the obstacles we face in finding solutions for our problem. If you are a patient who is considering nasal surgery, have an open discussion with your doctor about what it will entail and about empty nose syndrome. Find out what surgical procedure will be used and what turbinates and how much of them will be resected. Choose the most conservative surgery and surgeon. Make sure you have tried all preventative treatments before considering surgery. While I do know many doctors are being careful, the American Academy of Otolaryngology and American Rhinologic Society have not developed a proper standard of care for appropriate amount of turbinate bone and mucosa to be removed during nasal surgery. This failure to enforce a standard of care leaves anyone considering nasal surgery at risk for ENS. The doctors in these organizations are the ones who have caused this harm, so it naturally follows these organizations have a more moral obligation to help us. There is also no requisite protocol that patients must undergo allergy treatment to reduce the size of turbinates prior to a turbinectomy, and there is no one searching for a cure, although technologies are here that could benefit us. If you are a doctor, I know many doctors have been more conservative in the past 10 years, but I urge you to never remove a total turbinate. Be conservative. Please educate yourself about empty nose syndrome and our plight. Listen to your patients' complaints of symptoms, and find those patients who might be experiencing symptoms as a direct consequence of turbinate removal. For these people, please be ready and willing to diagnose this condition as empty nose syndrome, regardless of the discomfort doing that might cause. Please work together with us and with other doctors on our behalf. We have been damaged, and some